The annual Medicare Open Enrollment period runs October 15th through December 7th. This is for coverage that would begin in 2021, and it applies open enrollment to Medicare Part D plans and Medicare Advantage plans, the health plans, but not to Medicare supplemental plans. The key takeaway when we talk about open enrollment in Medicare is to review your plan every year, especially your Part D plan, because things change. Formularies change, copays can change, premium amounts can be different, and even which pharmacy is considered in-network. So if you like the pharmacy you go to now when you're reevaluating a Part D plan for 2021, make sure that same pharmacy is covered, is in-network for the plan that you select. If you like the plan you have now, still review it. Things can change, and you don't want to keep up your current habits of going to the same pharmacy and finding that all of a sudden it's out of network. There are a couple new things for 2021. The biggest one in the state of Wisconsin where we are is the senior savings model plans. Now, this is a flat $35 a month fee for a monthly supply of insulin. Not all of the Part D or Advantage plans offer this benefit, so make sure when you are reviewing plans, if this is something that would produce a good cost savings for you, make sure you use the Plan Finder tool, and we link to that in the description below, and search for plans that do participate with this senior savings model. Now, senior advocates advise people not to pick a plan simply based on name recognition alone, nor just premium alone. Instead, look to make sure that your medications are indeed covered. Again, formularies change all the time. You want to make sure you're in a plan that covers the medications you take. Also, know the costs, the premiums, the deductibles, the copays. Those look different in different plans. So do the networks, and as we said before, the pharmacies that are considered in-network. You can use that Plan Finder tool. It's available on the Medicare.gov website. You can click on the Preview 2021 Health and Drug Plans option. And one piece of advice that we've learned is to watch for footnotes when you're using the Plan Finder tool. Sometimes there are some default prices that are just placeholders. In the past, those haven't been well marked. We are told that for this year, they will be marked. So watch for footnotes. You might see this as a placeholder as a price. You don't want us to be surprised later. Now, there are always questions when it comes time for open enrollment in Medicare. And in the description below, we give you a number of phone numbers and websites that you can use as a resource, from the local Board on Aging and Long-Term Care to Disability Rights Wisconsin. But you can always call Medicare directly, and we share that contact information with you also in the description below.